Good evening, I'm Adrian Arsenault.
And I'm Andrew Chang. Tonight, Ontario declares another emergency and new restrictions.
We are at a dangerous point.
Does the response match the danger?
It's important that this be dealt with in a way where the public can see how serious this is.
How Canada's first case of a COVID variant was a fluke discovery. Why a couple faces charges.
We have reached an agreement with Pfizer.
In a bleak COVID winter, news that millions more vaccine doses are due this spring.
And Donald Trump rallies and rails.
The impeachment hoax is a continuation of the greatest and most vicious witch hunt.
Is he about to be impeached again? This is The National. Like the light from a faraway freight train, COVID's second wave was seen heading Ontario's way months ago. Well, that train has arrived with some force.
Yeah, that's right. And new government modeling shows just how destructive it could be.
We are at a dangerous point.
Those graphs, those are people. They're not just numbers.
And if that isn't scary enough, I don't know what is.
Now, the sheer number of patients in Ontario hospitals and ICUs is scary enough, but more so the speed at which that number is growing. And according to the data shown today, capacity is at critical. Most of the province's ICUs are at least 85% full. That often means just 1 or 2 beds left. And a quarter of ICUs are completely full, while others somehow push above 120% capacity. And as Magda Gabrasalasa shows us, the province is still expecting worse.
In the ICU, today's modeling is measured in suffering.
People in their 40s and 50s are dying of COVID virus. They're dying of pneumonia, and it's so sad.
And the projections are more dire still. Daily death rates that could double next month to 100 a day.
The number of cases in Ontario is growing between 3% and 5% almost every day.
By next month, up to 40,000 could be infected per day. The case scenario fueled by fears that the virus variant first found in the UK may be spreading here.
Effective immediately, Ontario is declaring a state of emergency.
Premier Ford issued a stay-at-home order. Again, people are being told to go out only for essential purposes. That includes groceries, visits to the doctor, and exercising. Going to work deemed essential is allowed.
When it comes to enforcement, we're allowing more police officers, more bylaw officers to implement fines for bad actors.
But critics say not much has changed.
Not only is the modeling that they showed us earlier extremely scary, but the lack of new measures by this premier is absolutely horrifying.
Non-essential shops can still do business with some limitations. Construction will continue at some sites, and outdoor gatherings are not banned, but limited to 5 people.
So clearly these restrictions don't go far enough.
And there will be consequences, says this doctor. At the very least, he expected to hear there would be a travel ban between regions.
To try to protect the regions that currently have better control of the virus versus the regions that are totally out of control.
To get cases under control, the province is rapidly running out of time.
And so, Magda, amid all of this, a lot of kids in Ontario won't be returning to in-class learning anytime soon.
Yeah, that's true for kids in the hot spots. So they won't be going back into schools until February 10th, at least February 10th. So we're talking about Toronto, Peel Region, York Region, Hamilton, and Windsor-Essex. And the numbers that we saw today really seem to support that. So when we're looking at COVID test positivity rates, school-aged children are among the highest rates. So, of course, that means this virtual learning will be extended for many of them. And because of that, you're going to have some parents that are going to have to work from home, at least the ones that can. And that, of course, falls in line with the province, with what the province wants right now, which is a lot less people out and about, Andrew.
All right, Magda, thanks so much.
Now, Ontario is also worried about the variant first identified in the UK and how far it has spread. CBC News has learned that the first 2 people in Canada were diagnosed only because of a fluke. And as Jonathan Gatehouse explains, this has led to some serious consequences for them.
Given the early evidence we have on this new variant of the virus, the potential risk it poses.
By the time Boris Johnson sounded the warning and Ottawa halted flights from the UK, it was already too late to stop the spread of the new variant to Canada. On Boxing Day, Ontario announced the country's first 2 cases, with a worrisome caveat that the Durham Region couple had no known travel history, exposure, or high-risk contacts. It turns out that wasn't true. The province later reported the couple had repeatedly failed to disclose close contact with someone who had recently returned from the UK. Now, CBC News has learned, they are facing charges.
We're all facing...
Carrie Bowman is a bioethicist at the University of Toronto's medical school.
That kind of deception is very, very serious indeed. And that's why it is important that this be dealt with in a way where the public can see how serious this is.
Durham Region Public Health won't name the couple or provide details about what tracing they've done in their workplaces, citing privacy laws. But CBC News has determined that these cases were only caught by chance. The lab processing the couple's positive COVID test chose to screen them for the variant at random, and that set authorities digging for an explanation. Apart from Saskatchewan, there's still no routine testing for the variant in Canada. It's typically done only in cases where there's a known connection to the UK.
I think it's important for people to understand how important it is to be open about a recent travel, even though they think maybe that might get them into some trouble.
New modelling released today by the Ontario government predicts the variant could become the dominant strain in the province by March, causing case rates to double every 10 days instead of the current 40. So far, there are fewer than 24 confirmed variant cases in Canada, most of them in Ontario, though with only about 5% of positive COVID results currently being tested for the variant, the real number may be much higher. Jonathan Gatehouse, CBC News, Toronto.
Now, in Ontario, as in most of the country, the pandemic's taking a horrible toll on healthcare workers. An April public health survey showed that even then, almost half of respondents across Canada said they needed psychological support. So, Lauren Pelly takes a look at what some of the newest data shows.
We fear for our own safety.
Whitby, Ontario resident Lamo Dolkar worked as a frontline nurse during the early months of the pandemic. She says it's always been a stressful job, but even more so now with the constant threat of COVID-19.
I personally, when I came home, I would be in the garage, stripping down, putting alcohol on myself, then going up and, having a shower before I could even hug my kids.
Canadian research published today suggests there were high rates of stress and burnout among healthcare workers even before the pandemic. Roughly 65% of physicians who responded to a hospital survey in 2018 and 2019 reported recent burnout. So did roughly 73% of allied health professionals like therapists, pharmacists, and social workers. Nurses had the highest reported rate at nearly 78%.
The levels of burnout were very high in my view.
This Toronto physician says his findings are from one facility but reflect a broader trend in healthcare.
If it was that bad before, what's it going to be now?
The research team hopes to remeasure burnout rates mid-pandemic, given the ongoing strain on Canada's healthcare system. Personal support workers, paramedics, and physicians are all among those now coming forward about worsening stress.
We really need to remember that physicians are people, which means that we've all been struggling with the same issues that the general public has been.
But for healthcare providers, that can also impact patient care.
If a nurse or a physician is burned out, it's much more likely that the patient they're taking care of is going to have some sort of adverse event.
It's just a vicious cycle that's ongoing, that's affecting patient safety, that's affecting our safety.
Dolkar says more supports are needed for healthcare workers since the stress of this pandemic isn't over yet. Lauren Pelly, CBC News, Whitby, Ontario.
Now, pandemic stress for some essential workers is also financial stress, especially those who cannot take a day off to get a COVID test. As Jacqueline Hansen tells us, this reality has sparked renewed calls for paid sick days in Ontario.
Rashev Brown has worked at a grocery store in Toronto for more than 10 years, yet he worries staying home sick would cost him.
I won't be able to pay my rent, might end up on the street because I might burn through my savings, eventually. So yeah, so it's very real for me.
He wants paid sick leave in case he needs to get tested for COVID-19.
Just having that reassurance that I'm going to get paid is like I'm not putting myself and other people in public at risk, right? I'm not putting my coworkers at risk.
But from retail to industrial work, many blue-collar employees don't have that option.
Most provinces in Canada, including Ontario, do not provide for paid sick days.
Some local politicians and health officials are calling for that to change.
I hear complaints every single day from constituents who are saying that this is something they need. This is a support that will make a difference in the spread of COVID-19.
Very simply.
In September, the federal government introduced the Canada Recovery Sickness Benefit, $500 a week if a person can't work for at least half of their scheduled hours. But while cases of COVID have kept rising since then, approved applications for the sickness benefit have fallen from more than 60,000 a week in September to just 17,000 in December.
The sick leave benefit is very cumbersome, and workers, they have to apply for it. They have to know how to apply for it, have the ability to apply for it. They also have to wait.
Toronto's mayor wants both the federal and provincial governments to step up and do more.
I'm almost to the hair lighting on fire time with this, where the fact there has been no response from anybody about this.
But today, Premier Ford wouldn't budge.
We aren't going to duplicate areas of support,
leaving workers like Brown to choose between taking precautions and getting paid. Jacqueline Hansen, CBC News, Toronto.
Now, Alberta has set another pandemic record after the province reported 38 more COVID-related deaths today.
If we do not have an approach that involves all of our community members working together to prevent spread, we risk having more deaths and increasing that burden on our healthcare system.
Alberta has seen a slow decline in active COVID-19 cases, but hospitalization numbers are higher now than they were a month ago. The province has lost more than 1,300 people.
This is no time for us as adults to, be making decisions that, quite frankly, are irresponsible. We all need to do our part for a little while longer to see our way, through this pandemic.
Saskatchewan's premier calling for resolve as the province extends public health orders until at least January 29th. Officials say the number of cases and hospitalizations remains too high, with an active case rate higher than every other province except Alberta.
There is some new hope on the vaccine front today. Canada has reached an agreement to buy enough new doses so that every Canadian could be vaccinated by September or possibly sooner. As David Cochran explains, for provinces in the grip of the second wave, the vaccines cannot come fast enough.
As the COVID situation darkens, the vaccine story gets a little brighter.
We have reached an agreement with Pfizer to buy an additional 20 million doses of their COVID-19 vaccine.
It means delivery should ramp up dramatically in April. Combined with existing doses and other vaccines expected to be approved, the goal is to vaccinate 20 million people by June, everyone by September.
Obviously, if we can do it even quicker than that, that would be great news.
Right now, Canada has given at least one dose to around 400,000 people. That's about 1% of the population. It's a rate that ranks about 10th in the world.
We need to get through this. We will have mass vaccinations happening in April, May, and June. We need a little bit of a runway.
That runway looks endless for provinces dealing with a second wave, while vaccine deliveries from the federal government remain relatively small. Alberta has even mused about securing its own supply.
And I've asked our legal folks to look at whether, if the federal government is not going to procure other vaccines that go to market, whether provincial governments can do so on their own.
But it's unclear a provincial government could have more success than a national one in trying to bulk buy the most coveted drugs on Earth.
When you look at the population of Canada, which is about 37 million, that is relative to the rest of the world not a large population, and so we really need to band together.
To meet any of these targets, deliveries will have to scale up dramatically, and so will actual vaccinations. To hit that target of 20 million by June, the country will need to be vaccinating more than 180,000 people every day through the spring. David Cochran, CBC News, Ottawa.
The Prime Minister announced a small cabinet shuffle today, confirming details that we told you about last night. And Justin Trudeau denied it was done to prepare for an election.
From the very beginning of any minority parliament, every political party understands that elections can happen. But as I've been consistently saying, we don't want an election.
When pressed by CBC News, though, Trudeau wouldn't rule out there being a snap federal campaign in the fall before all Canadians are vaccinated against COVID-19. Today's shuffle was triggered by the departure of Navdeep Bains from cabinet after he told the Prime Minister he won't be running for re-election. The Canada-U.S. land border will remain closed to non-essential travel until at least February 21st. The government calls it a key defense against COVID-19 for people in both countries. The restrictions began last March and has consistently been renewed month by month. And anyone flying to the U.S. will soon need to show proof of a negative COVID-19 test. A new order expands on a similar one announced last month for passengers coming from the U.K. New measures will go into effect on January 26th.
So let's turn to U.S. politics and the eve of Donald Trump's last week as president. Well, tonight, a defiant Trump lashed out even as he faces a historic second impeachment vote and even as the momentum against him is building. Susan Ormiston has the details.
No regrets. Trump's take on his incendiary words last Wednesday.
They've analyzed my speech and my words and my final paragraph, my final sentence, and everybody to the T thought it was totally appropriate.
A parallel universe as Congress rushes toward another impeachment vote tomorrow, which will likely pass, accusing Trump of inciting an insurrection.
I think it's causing tremendous danger to our country, and it's causing tremendous anger.
Of his own making, says Chuck Schumer.
Blaming others for what he caused is a pathological technique used by the worst of dictators.
But in a sign of rising tensions,
And where the First Amendment doesn't say.
he's interrupted on the street.
As long as there's outrage and unrest in our hearts, there's going to be unrest in these streets.
Trump took a last stand today in Alamo, Texas, likely his last presidential trip, still hugely popular with his supporters. Going to the wall, a huge success, he says, which has cost U.S. taxpayers $15 billion.
The 25th Amendment.
Warning Democrats that trying to force him out will haunt President-elect Joe Biden.
The impeachment hoax is a continuation of the greatest and most vicious witch hunt in the history of our country, which is very dangerous for the USA, especially at this very tender time.
Republicans argue it could further tear at this country.
Let's be clear. Democrats have been wanting to remove President Trump from office since he won the election in 2016.
But there are already cracks. High-ranking Republican Liz Cheney says she will vote to impeach. There's never been a greater betrayal by a president of the United States of his office and oath to the Constitution. And the New York Times reports Senate Majority Leader Mitch McConnell believes Trump did commit impeachable offenses, setting the scene for a dramatic day here tomorrow.
Okay, Susan, so we know that today the Democrats tried to remove the president even faster with a constitutional amendment, and where'd that go?
Well, Vice President Mike Pence tonight wrote to the Speaker of the House and said he would not invoke the 25th Amendment. So that's over, and it's on to the impeachment. Now, the White House is bracing for at least 20 Republicans in the House to vote with the Democrats to impeach Donald Trump, something we couldn't even imagine a week ago. And here in the Capitol, police are hardening security. It's pretty much deserted down here. There's more fence going up every hour as the FBI is monitoring online threats saying if President Trump were to be impeached again, there could very well be more violence, Adrian.
All right, thank you, Susan. Susan Ormiston in Washington tonight.
Now, today, the FBI announced it has opened more than 170 case files in its investigation of the Capitol Hill attack, with dozens of charges already laid. And D.C.'s acting attorney warns more will follow.
We're looking at significant felony cases tied to sedition and conspiracy.
Among those charged today is the fiercely pro-Trump son of a Brooklyn Supreme Court judge wearing an elaborate fur costume during the rampage. Aaron Mostovsky was charged with theft of government property, unlawful entry, knowingly impeding government business and disorderly conduct.
Vancouver police are asking for help finding a man who set fire to a homeless woman's blanket while she slept on a downtown sidewalk last month. They've released some pretty shocking surveillance footage of the incident. At the top of your screen, you can see the suspect lighting the blanket. The flames smolder before erupting moments later, setting fire to her belongings and burning her jacket. Now, the victim managed to quickly wake up. She was not physically hurt. And remember the violence at a fish plant in southwest Nova Scotia last fall? Well, today, 23 people were charged, all with breaking and entering, some with mischief. The incidents happened during weeks of unrest over the launch of an Indigenous moderate livelihood lobster fishery. A fire at the same plant is still under investigation.
Well, in Ireland, a shameful past. An inquiry reveals 9,000 children died in homes for unwed mothers.
Babies crying. Why? Because they were uncomfortable, they were neglected, starved and cold.
Next on The National, the horrific treatment of unwed mothers and their infant children.
As Ontario's long-term care homes struggle with another wave of COVID outbreaks, one woman takes matters into her own hands.
I love you. What would happen if she was alone? It frightens me.
And as airlines grapple to stay afloat, a new opportunity emerges.
I never expected this. I never thought this could happen.
We're back in 2.
Look at that. Central Spain continues to dig itself out after a weekend of really heavy snow. A very tough job when you see what it looked like just 3 days ago. More than 25 centimeters fell on Madrid. That is the most in half a century. And after that punishment, today the region was plunged into a deep freeze, further disrupting travel plans for thousands of people. Many remain stuck at airports. Officials say at least 7 people have died due to the weather.
Well, the Catholic Church in Ireland has apologized to survivors of institutions known as mother and baby homes. That's where unmarried women and girls were sent during pregnancy, then forced to give up their babies. As you'll see from Margaret Evans, a new inquiry report has exposed decades of deep pain.
A small garden in the town of Tuam, where paper hearts and baby shoes hold vigil over one of Ireland's most shameful secrets, the scale of it surfacing still. It was the site of the Bon Secours mother and baby home, where so many unwed mothers were sent in disgrace. PJ Haverty was one of the children born there and then taken from his mother.
was always the woman that was to blame. It was always the woman's fault. And that's why I like to give my story out there. And I want this to go into the history books of Ireland.
Still, Haverty counts himself as lucky. He eventually met his mother. He also survived. Nearly 800 children from the church-run home didn't. The remains of many, from babies to 3-year-olds, thought to be buried under the ground in a sewage tank. The report released today says 9,000 babies died in 18 religious institutions over several decades.
The regime described in the report wasn't imposed on us by any foreign power. We did this to ourselves as a society. We treated women exceptionally badly.
Campaigners have been calling for an inquiry and justice for the victims for several years now. Not everyone believes this report is enough. Catherine Corliss, credited with discovering the mass grave in Tuam, is disappointed with it.
The burials and disappearance of babies, that wasn't approached on at all. And those issues are of utmost importance to survivors.
PJ Haverty agrees with her.
There was nothing there today that would say, God, that's fantastic, now my mother is being recognised, or they're apologising to my mother. And they didn't do that today.
The past is still a long way from being put to rest. Margaret Evans, CBC News, London.
Next, a woman moves into her mother's retirement home and then fights for her survival.
It's been 2 weeks today that my mom got diagnosed with COVID, and I decided to get her through it.
The stress of keeping the most vulnerable alive.
And as parts of Canada grapple with a surge in ICU admissions, we speak with a doctor about the breaking point.
Welcome back. The disaster unfolding in Ontario has a familiar ring, not just in its scale, but also in where it is hitting the hardest.
Mortality in our long-term care homes is now on a pace to exceed the tragedy of the first wave.
Indeed, new modeling data shows more than 1,400 long-term care residents, another 1,200 plus staff are now considered active COVID cases, numbers that have surged in recent weeks. What was already a problem across the province in the summer has this month become a storm of sickness and increasingly death. So you are about to get a look at an outbreak through the eyes of a woman who went into that storm to save her mom. David Common shows us how loved ones can be a bulwark against disaster in long-term care if they are allowed to be.
Mary Sardellas knew in order to save a life, she'd have to risk her own. With COVID inside Park Place retirement residence, her 98-year-old mom infected and staff overwhelmed, Mary stepped into the outbreak, something most homes still won't allow, and she stayed to help.
Hi there, okay, I just have a series of questions for you.
Yes? It is a bold choice to move into a senior's home in the middle of a COVID outbreak.
There is no choice. If this woman is going to live, be it with her language and hearing disability, she will be isolated, unable to communicate with anybody. She won't make it. And so I have to do what I have to do. I don't have a choice.
You moved in.
I moved in.
And you became her primary caregiver.
24/7. And it was 24/7.
And what effect did that have on care?
For my mom, zero.
It didn't impact her because you were there?
Because I was there. Because
what if you hadn't been?
She wouldn't be alive. You can ask any of them in there. You can ask any of the nurses who have said it, any of the PSWs that said it, she wouldn't be alive.
You're that certain?
They're that certain.
While seniors' homes have been ground zero for COVID, seeing inside during an outbreak is a rarity.
Hi, this is me in a closet in my mother's seniors residence.
Mary kept a video diary showing her fight for her mom's survival.
There she is.
Hoping not to become infected herself.
The last thing I need is to get COVID. Taking care of her defeats the entire purpose, so everything gets wiped down. She goes to the bathroom, boom, everything. When the PSWs come in, everything gets redone. The handles, the light switches, the everything. It just non-stop. It's no man's land here. Like, nobody wants to come on the second floor.
Welcome. Okay, that's good.
Yes, I love you. I love you.
I love you too. She's not eating. I'm literally calculating and trying to figure out what am I going to throw together to get her to eat. Okay, shh. I just got to do this, Mama. Her breathing's labored still. The amount of times I've had to get up tonight to give her something. Oh, even just sips of water, and oh boy, she's so thankful. What would happen if she was alone? It frightens me. I know. There we go. Hey, right on, 35.7. Yeah, she's definitely turned a corner.
After 2 weeks of around-the-clock care from her daughter, it's a promising sign for Vula.
It's 35.7? That's fantastic.
But that relief is fleeting. COVID is a wicked roller coaster with bouts of delirium suddenly taking hold. It's getting harder.
It's been 2 weeks today that my mom got diagnosed with COVID, and I decided to get her through it, and she's gotten through it. But I'm officially burnt out.
Mary is beat and calls an ambulance for help.
I'm going home. My mom's in the hospital. The ambulance came to take her. It wasn't a pretty situation with the ambulance. She was very, very combative, striking out. I'm not happy to be going home. I miss her already. I hope she's okay at the hospital.
Getting her mom this far has been a battle, but for relatives in other homes across Canada, the fight has been for access.
At the beginning of the pandemic, family members, caregivers were locked out of long-term care homes, retirement homes. What was the consequence?
So without them there's a reason why we saw such drastic deterioration and many deaths that were not just from COVID alone.
Vivian Stamatopoulos is a caregiver researcher at Ontario Tech University.
They provide everything from personal care to, basic activities of daily living. We're talking about helping people to eat. I mean, we could have prevented a lot of those, malnutrition and dehydration deaths from just having family in place.
And you were outspoken about getting caregivers back in. Why? Why so passionately on that subject?
Because I know how important they are. I had a loved one in a long-term care facility, and I saw for myself how there was never enough staff around. Staff were running on their feet. They were always burnt out. They were always overwhelmed. There was just never enough people.
As we get deeper into this second wave of COVID, many provinces are still saying homes should shut out family altogether.
The provinces that didn't have quite the first wave we did are using that knee-jerk response to just close everything down. And they think, erroneously, that you can place this iron ring around homes. You cannot do that.
Mary believes her mom's survival is directly tied to getting outside help into the retirement home. She's back there now, recovering well after a week in hospital. Mary doesn't sleep at this home anymore, but visits daily to help her mom.
As long as she wants to be alive, I will do everything to keep her alive.
But Mary knows if her mom caught COVID last spring, when homes were locked down, extra caregivers like her would have been kept out.
When family are there, they drop off everything, we take care of everything. They don't come in the room, they're saved in exposure for their own good, but I have saved them from entering my mother's room and going into the non-COVID person. There's a win-win to allowing family in the room.
But they would argue that they are protecting the people who live there by keeping...
You want to protect them? Let the family in. We are a solution, not a problem. She's coming out for fresh air, first time in almost 4 weeks.
Mary hopes what she was able to do will at least be an option for others, a needed part of care during COVID.
So, David, like a lot of provinces, Ontario, we know this, prioritize long-term care staff and residents for the vaccine. But is this rollout happening fast enough to make an impact, at least for them?
Really depends on where you are. Here at Tender Care, more than 70 people dead at this Scarborough long-term care home. They've now been immunized just in the past couple of days, but it's because of where they are and how badly they've been hit. If you're in the Greater Toronto area, much more likely to have got the shot. Not in that area, in one of the other 28 public health areas that are in outbreak, not going to be getting it as quickly.
David, how could the second wave be worse in long-term care, given that everybody knew it was coming?
Yeah, lots of questions about that. Opportunity with the lull in the summer, perhaps that iron ring just not strong enough. Consider that it is worse now than in the first wave. 40% of the homes in this province now in outbreak. It is bad and getting worse.
All right, David Common. Thank you, David.
And still ahead tonight, a new flight plan to make it through the pandemic.
More people want to get in. It shows you that cargo is all of a sudden, the business to be in.
The Canadian airline, whose business is soaring.
Looks like fun. Moments of joy and laughter at a COVID checkpoint. The inspiration a little later.
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast, Front Burner, the RCMP is now investigating a death tied to the massive COVID outbreak at the Cargill meat plant last spring. We'll hear why that's significant. Subscribe wherever you get your podcasts.
Welcome back. We've devoted a fair bit of our program tonight to the explosion of cases in Ontario, with word of another state of emergency going into effect this Thursday. But we also wanted to look westward to Alberta, where daily case counts have actually been trending down, but where the overall number of people in hospital has still been trending up. So let's turn to Dr. Lenora Saxinger, an infectious diseases specialist at the University of Alberta in Edmonton. And Dr. Saxinger, I make that point about hospitals because Ontario's breaking point has everything to do with ICU capacity. How close to that breaking point would you say Alberta is?
Well, I think we've been walking that line for a period of time now. Our cases started to go up in mid-December and have just turned around and started to come back down fairly slowly. But there's a big lag time between cases in the community and cases coming into hospital, and people are often hospitalized for 1, 2, 3, 4 weeks at a time. So it takes a long time to see the effects of improvements in a hospital setting. And we've really been running at extremely high capacity, and people are starting to get, I think, overworked, and the system is really straining at the seams.
And I mean, there are ways to create capacity where there hasn't been capacity in the past, but I suspect it also means making some pretty difficult decisions at times.
Right, so between finding beds and equipment is easy, finding staff is hard, and there's a kind of natural limit to the amount of good care you can provide to the level you want. And there's also a process whereby people who might have been given a chance to see if they can benefit from critical care might be less likely to get that chance, because there just isn't room at the inn anymore. And that's something that's very, very difficult for the people who are providing care to make decisions about.
So then, I mean, it leaves me wondering whether other provinces, such as Alberta, would consider the kinds of emergency measures that we're seeing here in Ontario. And I don't know whether you think that would be effective.
Well, because our numbers are starting to drop and the rate of increase in hospitals is dropping, I think it would be hard to argue for a change in course right now, but we've been running, well above a threshold that we've previously set in terms of active cases for additional measures. And I think if things start turn in the wrong direction, that would really have to be considered. I mean, above 100 cases per 100,000, you start to see health system strain. When you're up around 400 or 500 cases per 100,000, it's really easy to see that you cannot provide the kind of health care you want for the population anymore.
Right. Dr. Saxinger, thank you so much for your time. I really appreciate it.
Thanks.
And hey, for all you folks at home, if you have COVID-19 questions for our doctors, you can message us directly on Instagram at CBC The National, or you can send us an email at covid@cbc.ca.
And at this point, more than 17,000 Canadians have died from COVID-19. We have been sharing their stories told through loved ones. Well, tonight, a daughter remembers her dad and his last dance.
My name is Ellie Stein. My father, Richard Stein, died of COVID-19 on November 3rd, 2020. He was 80 years old. My mother tells the story that they first met at a dance. And at the time they met, they were both in college. My dad came up and asked her to dance. And to hear my mom tell the story, she says it was love at first sight. Early on in their marriage, my dad, knowing that my mom loved dancing, bought her some ballroom dancing lessons. They continued to take lessons together for about 50 years. One of the things about my dad that was notable is he really loved the outdoors, staying in shape to be able to go to the mountains in the summer to hike and take wildflower photos. He was a neuroscientist, and his area of interest was studying how nerves conduct the impulses to the muscles and make the muscles work. Really, our family wasn't so aware of what happened in my dad's work life. He didn't really talk about it when he came home. But since he's been ill in the last couple of years, we've been getting all of these emails and letters that are just, so heartfelt from neuroscientists around the world, thanking him for basically helping them in their career get to where they are today. He treated everybody with respect. He was so generous right to the end. After my dad had been in hospital and then in long-term care, he had really declined in his ability to walk. And he set himself a last challenge. Not only did he want to walk again, but he also wanted to dance. When he made that decision, a bunch of people came forward, former students and colleagues who had the expertise to help. And in March 2019, my parents put on an exhibition at the Edmonton General Continuing Care Centre of ballroom dancing to 3 songs that were really meaningful to them. He was very loving, and I'm gonna miss him a lot.
What a love story. Richard Stein was just one of so many lost in Canada, lost to COVID-19. We have been sharing their stories through our interactive website. You can check it out at cbc.ca/remembered.
Canada's biggest airline is dropping a number of destinations from its schedules, particularly in places that were already hard to reach. So as of January 23rd, Air Canada is suspending service to Yellowknife, Fredericton, as well as 3 flights to Newfoundland and Labrador, which leaves Labrador with just 1 regional carrier. And Cape Breton Island now has no domestic passenger service at all, in or out. The last flight to Toronto took off yesterday morning. So while the pandemic continues to stifle passenger service in Canada, there is one airline that's seeing its business soar. And as Ashley Burke explains, now other companies are trying to move in to fly cargo.
10 months into the pandemic, airports are empty, but planes at Cargojet have never been more full.
It's very busy. It's during the day, it's all night. Planes come in, planes go out. They're maximized. Bellies are full, top deck's full.
So busy, Cargojet hired another 400 people to keep up, and the industry has noticed the increased demand. Now Air Canada is expanding its cargo capabilities too.
More people want to get in. It shows you that cargo is all of a sudden, the business to be in. So I think I never expected this. I never thought this could happen.
AJ Vermani is a self-made entrepreneur who came to Canada from India in the 70s. Over the past 2 decades, his business has grown to be worth billions of dollars and is now the dominant cargo airline with hundreds of flights a week.
Cargo was never, a great business to be in. It was kind of the basement, bottom. It goes in the bellies of the aircraft, so it was always looked down upon. But I think it's opened a lot of eyes now.
Early in the pandemic, the carrier flew hundreds of flights overseas to pick up critical PPE for the Canadian government and used celebrity ambassadors to motivate staff.
On this pandemic, you guys are still operating at a 99.9%. That's unbelievable.
Well, it's been a banner year. Analysts say other airlines are encroaching on the market, but Cargojet still has the stronghold.
Air Canada will pick up a sort of larger share of the incremental growth in the market. It'll still leave Cargojet with a solid share of the market and good revenues.
Since March, Air Canada has removed seats from a number of its passenger planes to offer cargo-only flights for the first time, a business bringing in much-needed revenue that it plans to keep growing. Ashley Burke, CBC News, Ottawa.
Coming up on The National, a dance challenge goes viral. The story behind this and the joy it's bringing people in the midst of some pretty dark days. That's next. Normal. Well, you are looking at a security worker at Montreal Lake Cree Nation taking part in what's known as the Checkpoint Challenge. So the checkpoints ensure those entering the community live there and don't have any symptoms of COVID-19, but the dancing helps the security officers have a bit of fun in the meantime. And tonight, that's our moment.
It's just started off like that, you know, kind of like a friendly, fun kind of challenge to get people dancing, jigging, kind of out of their comfort zone. So we kind of wanted to challenge other First Nation reserve security to see what they got. And now there's videos popping up left and right. I was tagged in a video of one of my friends doing it. So I was like, okay, all right, bet. You know, I was like, you guys want this smoke? I'm gonna show you, you know? So I didn't think it would like blow up the way it did. Cause like right now it's already at like over 10,000 like views. It's so cool to see other First Nations get involved. Oh, this definitely pushed me out of my comfort zone. I'm definitely not a jigger dancer, but it's such a positive thing in our communities. As long as I made my family laugh, and if I can make other families laugh, then that's, you know, good enough for me.
So I can totally empathize with the idea of dancing being out of one's comfort zone. But the added challenge that he was telling us was that he was sort of struggling to remember the jig that he was taught as a kid. But I don't know, to my untrained eye, it looks pretty good.
It looks great. It's great to watch. It's great for JC. He says that he can't see his family, right, because of the pandemic. But he's connecting. Everybody is finding their ways to do it. And the longer this goes on, the more of you keep reaching out to us with stories like this. And we love it. Thank you for that. So it is the National for January the 12th. Good night.
Good night.